I have a lot of passion for airway health. If I can help a young child get the proper airway so they can breathe properly, so they can sleep properly, they'll be able to concentrate better in school. Asthma and allergies will oftentimes reduce. They've got a full lifetime ahead of them. There's no reason for people to be going and getting sleep apnea as an adult if something can be changed as a child.
Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we are coming to you from our studio, Muscle Activation Schaumburg in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset. Your health is one of the biggest influencers of the quality and quantity of time that you have. And while there are many aspects of health, our expertise is exercise. Exercise has been proven time and again to not only improve your health, but also increase your longevity and improve your quality of life. But we know that exercise is not the only piece of the puzzle, and that is why we are bringing you a rock star guest today, none other than Dr. Diehnelt. Dr. Diehnelt has enjoyed working as a dentist for more than 20 years. Although a native Midwesterner, she earned her doctorate of dental surgery from the University of Washington in Seattle and practiced dentistry in California and overseas before choosing to settle in the Chicago area. Dr. D, as she is affectionately called by her patients, completed her undergraduate studies at the University of Iowa in Japanese and spent a few years in Japan studying its language and culture. She also earned master's degrees in both international affairs and economics. Results of her studies and dental research were published here and abroad. Dr. Diehnelt is a member of the North American Association of Facial Orthotropics and is a staunch supporter of the Foundation for Airway Health. Dr. D, thank you so much for joining us and welcome to our show.
Thanks so much for having me.
Yeah, absolutely.
I feel like I need to beef up my bio after hearing about yours.
Right?
Congratulations on all your accomplishments. I can't wait to hear more about them.
Yeah, very cool. So why don't you tell us more about kind of how you got into dentistry despite having this very broad and very diverse academic background?
Well, it actually started when I was in high school, and, what do I want to do? I was interested in being some type of doctor, but I didn't want to go through the residency program, and dentistry offered being your own boss as well as the ability to do things with your hands, and I was sewing and enjoyed working with my hands, so approach things in that way. I did visit a dentist, and everyone will laugh at this, who was in my town of Menominee Falls, Wisconsin, and he ended up pulling a baby tooth, and I started to faint, and he put me on oxygen. So that was the first extraction I'd seen. Now I'm a little bit stronger now, but it was a field I'm glad I'm in right now, and as you can see, I do have other interests.
Yeah.
But, it gives me the chance to run my own business, changing my hours as need be for the family, and provide some really cool care for people.
That's really neat. That's really neat. So talk to us more. How did you get into all the different, like you say, interests that you have, whether it's economics, international affairs, learning Japanese, and then do you tie those back into your dentistry practice?
The economics degree was earned overseas because my husband was in the Navy. And so there wasn't much I could do there professionally, and they did offer a master's degree in economics. They flew the professors over from Oklahoma, and they taught the course in 1 week. So that's how I got my economics degree. The Japanese started when I was in high school and wanted to become an exchange student, and was sent to Japan for a year, and actually lived with a Japanese dentist and his family in Tokyo. So that's another dental connection. So then I also went to Japan for a few years after I completed my undergraduate work, and was actually in Osaka University School of Dentistry, Pediatric Dentistry Department for a year and a half doing research, but it really wasn't that much research in Japan. The average students are known to not study very much because their system is much different than ours. It's difficult to get into the college rather than to graduate from college. So once you're in, you're pretty much guaranteed to graduate. Okay. So long story short, I studied a lot of culture when I was over in Japan, even though I was at the university. But I learned some dentistry there, and then I came back and went to University of Washington because I met one of the professors from University of Washington when I was over in Japan.
Oh, neat. Very neat.
So when did you finally settle in this area?
That was around the year 2000.
Okay. Have you been a dentist ever since you've been in this area?
Yes. Yes.
Okay.
Yes.
So once you were here, you were a dentist.
I was a dentist even before that.
Okay.
Overseas a little bit, in California a little bit. Yes.
Great. Perfect. And I know one of your specialties is airway health. What is that all about?
It's about recognizing the importance of the airway and helping people breathe properly and have the benefits of a proper airway. It's learning to recognize in the mouth indications of poor airway, which would mean poor sleep and poor breathing, asthma, allergies, all these common problems, health issues that people have are oftentimes airway issues, and it's not really recognized very much. And your next question is going to be, why did I get into this? Oh, well, family. My father, this is about 20 years ago, started complaining about his inability to sleep. Oh, I have to sleep in the chair. I can't lie down. And about that time, we started to see in the dental literature dental sleep medicine articles. Oh. And I took a class, and it was very interesting. It was about sleep apnea and oral appliances to correct sleep apnea, and I made my father an oral appliance. And he was an old German guy, about 85 at that time, and he said, I'd rather not sleep than to wear an oral appliance like this.
Yeah. I've heard bad stories about those. They're uncomfortable.
Oh, you're between a rock and a hard place with sleep apnea. So what I'm doing now is working mostly with kids, but it does work on adults also, trying to grow their jaws, to grow their airway so they don't get to sleep apnea.
Interesting.
But that's what got me interested in this field of airway and health. Long story short, he broke his first appliance, and I made him another one, and he turned to my mom and said, pay her for it, I'm not going to wear it. He had already given up on his life. And on a personal note, right after that, I went to China and brought my second daughter back. My second daughter got to see him once, and he passed away within a month and a half from gangrene.
Wow.
The gangrene was from the poor circulation from the diabetes. He's been diagnosed at 75 with diabetes. And I remember thinking, I know there's a podcast, no one can see me, but I'm tall and thin. He was always tall and thin and very active. And I remember at 75, I was overseas with my husband and hearing that my dad was diagnosed with diabetes and scratching my head and go, something's not right. He actually has sleep apnea. It was the sleep apnea that brought on the diabetes.
Wow.
So if he had been properly diagnosed and treated for the sleep apnea at that point, either with an oral appliance or the CPAP, the mask, and he refused the mask, he would have been able to see my daughter more than once.
Oh, my gosh.
But so you can see where I have a lot of passion for airway health. If I can help a young child get the proper airway so they can breathe properly, so they can sleep properly, they'll be able to concentrate better in school. Asthma and allergies will oftentimes reduce. They've got a full lifetime ahead of them. There's no reason for people to be going and getting sleep apnea as an adult if something can be changed as a child.
Sure.
So how do you go about, number one, figuring out if someone is a good candidate for this, and how do you work with them on this airway health? It seems very difficult.
Well, let's start talking about kids, because adults are different. Well, it can be similar approach, but kids have much more potential. With kids, they will come to me with crooked teeth, because I'd like to call it the compromised airway syndrome. If they have crooked teeth, they have other symptoms of a poor airway. And they're not going to come to see me if they have asthma and allergies or ADHD. That is taken care of by the ear, nose, and the throat specialist, the allergist, whatever. They aren't thinking, oh, I've got eczema. There's something the dentist can do. But eczema is an airway issue. It's related to asthma. You may have heard that asthma and eczema are connected. They're airway issues. Huh. What I do is I can treat the teeth because that is my scope of practice, the jaws and the teeth. And I can expand the jaw. The jaw is very malleable, actually. I can expand the jaw to create a better airway. And I can help people breathe through their nose rather than their mouth. And that's how we get a better airway. And the teeth can get straight at the same time.
Interesting. Very interesting.
The body as a whole, the body knows what to do. The question is, what's causing the problem?
Sure.
What's causing, if we address the cause of the problem, not just medicate the symptom, we can get a lot better results. So the cause of the problem in most kids is their mouth breathers. Okay? Mouth breathers, or they're swallowing incorrectly. So incorrect swallowing, incorrect breathing creates pressures with the muscles in the face that make the jaw not grow to its full potential.
Okay.
It's a hard concept for people to understand if they don't fully open their thinking to it, because we're ingrained. Okay, you got 2 crooked teeth. It's genetics. Your dad had big teeth and your mom had small jaws, so therefore you got crooked teeth. No, the body doesn't work that way. The body knows what to do, but we get in the way. And I like to say, if I had a stone in the bottom of my shoe and I wore that all the time, my leg would grow, but the body would adapt to it. And if I took the stone away, I wouldn't automatically be right again.
Right.
It would need some try. The body knows what to do, but we'd have to train it what to do. And that's the same thing with the face. So a lot of the kids that come into me, they're developing long, narrow faces, maybe droopy eyes, because the face hasn't grown forward like it needs to. Think of the Julia Roberts face, forward, lots of teeth. That's the healthy face.
Okay.
Put it in Hollywood terms, Cruella de Vil, the Wicked Witch of the West. They've got that long, narrow face, the droopy eyes, that crook in the nose. That's because the mid face hasn't developed enough for the nose to stand on, so the cartilage, which is at the tip of the nose, flips down.
Oh, interesting.
Isn't that amazing how you can start looking at faces? And if you look at the people, they're probably mouth breathers. If they don't have their mouth wide open, it's a little bit, and they're breathing through their mouth. So the muscles on the side of the face are pushing in, and the jaw is being drawn down. And then with the lower jaw being on a hinge, those lower teeth become even more crowded.
Okay.
So with people that have crowded teeth, you've got inadequate growth of the jaw. The upper jaw didn't get to the proper size, and it's then crunching the lower jaw as it grows down.
Sure.
So with kids, we jump in as soon as possible. And then I do mean as soon as possible. If I see a baby who's with the mom or dad, anyone, and I see the baby is breathing through their mouth, I say, if I've got the courage and I think it's appropriate. Well, this is such vital information that could save a kid from asthma, allergies, ADHD, all these things. Did you know that if the kid breathes through their mouth, not their nose, that will lead to crooked teeth? I'm not going to take them to the point where, and when they're an adult, mouth breathers are 1.5 times as likely to develop dementia and likely to die 7 years before for nose breathers. That's not quite on the spectrum, but that's what I talk to an adult about.
Sure.
But as soon as you see the bad habit, and that's what it is, developing, let's address it.
So do you work with people on like their physical breathing, like whether it's belly breathing or focus on breathing more through your nose, or do you give them different drills to do, or what does that look like?
So I've got different a bag of tools that I can use, and usually what I do is I use an oral appliance that starts quite soft, kind of like a mouth guard for sports. And they wear for 2 weeks, and after that we start with the exercise. And the first exercise is abdominal breathing. And we tell them, quickly keep your lips closed, breathe through your nose. Tongue goes on the top of the palate. The tongue needs to be on the top of the palate because the top jaw actually forms around it. It is the template. And then the lower jaw comes along for the ride because the upper and lower jaw are hooked together with the hills and valleys of the teeth. So I really don't have to generally do much to the bottom jaw. If I've got the top jaw going where it needs to go, I've got them breathing right, lip sealed, things will come together.
And is that for both kids and adults? Because kids, it would seem like you're saying the jaw would be very malleable, but at some point, you would think, or at least I would think, that the structure would get more defined, would get more set. So is it a different process, or just a same process, but just a much longer timeline with adults?
You've got much more potential with the kids.
Sure.
But the principles are still sound. The changes in the jaws are still possible, or changes in the jaw are still possible as an adult, but it's more limited. But the adults usually are more compliant because they're paying for it and they really want to do it. So we all have the ability to grow, adults, 40s, 50s, 60s, basically the entire life, because we still have the precursor cells in our body. And we can expand. And I have a friend of mine who's a yoga instructor who was a very high executive at one point. She mentioned to me that once she started yoga, she could see that her face was changing. It's subtle, but it shows that things can change at all points in life.
Yeah.
And let's harness the power of the body and move forward.
Very interesting.
That way.
You said it's a lot of times the mouth breathing, you'll see it starting even as babies. What causes the babies to either be a mouth breather or a nose breather, or is that like probably a highly debated topic?
In general, it's just poor habit. Who's sitting up straight today and who's not? Did anybody tell you to sit slouchily? Is that a word? And it was probably a cold or something they had at one time, and they started to breathe through their mouth, and they never went back to breathing through their nose. A lot of people believe they are mouth breathers because they can't breathe through their nose. There are some that physically can't, and that's when we have to call in the ENTs that can do a good evaluation and possible treatment for that. But the great majority of people, it's just habit. And when I'm talking to little kids, I explain to them, well, the nose is up on top of the top of the mouth, and if you don't breathe through your nose, it kind of gets lazy up there, and it's like they're eating potato chips and they're throwing the garbage on the floor, and they get lazy. But if you close your mouth and make it work, it will start working. And that is really the truth most of the time. And I will have kids hum with me, and they will be able to hum for 30 seconds to a minute without a problem.
Interesting.
And then I turn to the mom and I say, well, I can see he can breathe through his nose if he just closes his mouth. The body's not going to make you die if you close your mouth. Think of it. I had one patient I just started recently, and they put in the soft appliance on the way home, and the mom said, my gosh, you're right. We were going home, and he was just getting all this gunk out of his nose. I told you it works. So it's let the body do what it's supposed to. The nose is where the air is supposed to go, and if you're not using it, it shuts down. If you don't use your arm, it atrophies. It's the same thing.
Sure.
Let the body do what it can do. It's amazing.
Yeah, that's really neat. So you get somebody to start breathing through their mouth, and then
breathing through their nose.
Oh, I'm so sorry. Yeah, so sorry. Let me take a step back. So you get somebody to start breathing through their nose, and then at what point, or is there a point in the process where you actually have to intervene from a dental perspective, as far as looking at, either trying to straighten the teeth or trying to adjust the alignment of the jaw or anything like that?
Yes, there are several tools in my tool bag, and I avoid as much as possible using the traditional orthodontics because it's retractive, and it also tends to have the tendency to shorten roots if we're not careful. And then all the brackets and things cause decay around things around the teeth. But wires I use with removable appliances, or I put a wire on the inside, which then hooks onto the molars in the back. And that is used to encourage the tongue to push the teeth forward. So I do have various different techniques to move the teeth more like traditional orthodontics.
Sure.
So, yeah.
Okay. Very interesting. Very interesting. So when people are doing these kind of exercises at home for their breathing, focusing on breathing through their belly, is humming something that you have them practice on their own?
No, I don't have them do humming.
Okay.
Breathing exercises, tongue exercises, lip exercises.
Oh, talking about the tongue and the lip exercises.
Muscles. You're the muscle expert.
True.
Did you study muscles of the tongue and the lips? And,
so we actually don't work with muscles of the tongue and the lips. So we're just looking at muscles that would, control our more synovial joints. So not the tongue and not the lip muscles.
Okay. Here's a question for you. It takes 1.8 grams of force to move a front tooth. How much force do you think the tongue has? It's a muscle.
Yeah.
It's a muscle.
So what I've heard is that it's like the strongest muscle in the body, but I couldn't quantify it for you.
500 grams.
Wow.
So you can see why training the tongue to be where it's supposed to be is so important. It's supposed to be on the top of the palate, about 5 millimeters behind those front teeth. We call it the spot. Tongue on the spot. Lips together, breathe through your nose. That's the mantra. That's the mantra. And so if people don't come and see me, if that's all they learn, they can benefit from that. Simply. So the breathing exercise, we help them develop their breathing capacity, as well as just the diaphragmatic breathing, tongue exercises, strengthening the tongue muscles so it can be where it's supposed to be. And then lip exercises are keeping them sealed.
Okay.
For the most part.
Okay.
But it's using the muscles around the face.
Gotcha.
And some of it is there's too much muscle tension. The chin muscle, if there's too much tension on that'll push the lower teeth back.
Okay.
So getting the body in balance.
Interesting. Very interesting. So one thing that I've been doing for probably a year or so now is something called mouth taping, especially at night, okay, to try to reteach me how to breathe through my nose, especially when I'm sleeping. Talk to me about that. Are you familiar with mouth taping at all? Do you find it beneficial at all? Or am I just, wasting my money on the mouth tape?
You can use some really, really cheap tape and it's effective. I'm going to step back a little bit. The appliance I use is one where it has a spot where your tongue goes, so you know where the tongue is supposed to be going, and it has cheater holes so that it initially can still breathe through your mouth, but that it is encouraging you to breathe through your nose. So that's one of the main reasons for using the appliance. Taping, a lot of people that work in my field like it, but we don't tell patients to do it just from the fact that, could you imagine the Tribune article on the top front page going, dentist kills patient because the patient taped their mouth closed.
Okay.
But yes, it can be very effective and a lot of people use it.
Okay. All right, cool.
And I will sometimes mention it that there are some people that go and use this and find it helpful.
Sure.
But I'm not saying that you need to do it because of the
potential liability.
Definitely.
So if you're willing to take the personal risk for if like me myself, I'm willing to take the personal risk. And actually, it's funny because the first few nights that I did it, the tape didn't stay on at all.
Rip it off.
Yeah, because I'd be breathing, and then it would feel like 30 minutes in, I'd just go. And, like all through my mouth, and because I felt like I couldn't breathe through my nose at all, and that probably lasted for about 3 nights, and then it's gotten subsequently better, and now it'll stay on all night, no problem. But I can definitely see that if the tape were any stronger, that would be a big issue.
And especially working with kids.
Sure. Oh, sure.
That we want to be careful. As adults, it's one thing.
No, that makes sense.
Everybody has their.
Yeah.
Definitely.
So it seems like a lot of the changes that you're making in the mouth, you're doing through, natural ways of like, let's reteach and retrain the body, which is really cool. But the current way, as everyone knows, is, you go to the orthodontist and you get these metal things on your teeth and it physically changes, your teeth. Is the results that you're looking for similar to the results that an orthodontist would be looking for?
Yes, but no.
Okay.
My approach is I want the function to be good. I want the breathing to be good. If the teeth are a little bit crooked, that's not my main concern. The orthodontist, his goal is to get the teeth straight. Mm-hmm. My goal is get the body breathing properly, swallowing properly, sleeping properly, and the teeth come along, and they end up pretty straight.
Sure.
Yeah.
So like the end goal is different in a way.
Yes.
Because yours is more function. Theirs is definitely aesthetic and then also function a little bit.
But if we go through treatment, the teeth are straight.
I see.
It's just not that Hollywood smile where you might want to dink a little bit here and dink a little bit there. It's okay. You've got the smile. You're smiling fine. And if you want to go to that extra little step, it's possible to do. But it's overall health and feeling good about yourself.
Right. And that's cool that you can just change how your face and the muscles of your tongue and of your face are functioning, and that changes your teeth. Because we almost think about our teeth as like they only move if we get braces, or a retainer or a mouth guard or whatever. And it's really interesting that you take this different approach.
And why do you need retainers after you've seen an orthodontist? Because the orthodontist will mechanically push the tooth in one place. Well, where did the body put it? Why did the body put it there? That's where the muscles had it go.
Sure.
So when I'm finished with treatment, the patient usually does not need a retainer because the tongue and the lips are the retainer.
Right. It's not like there's something in your mouth that's trying to push it back to where it was. Yeah. I see what you're saying. Interesting.
With the tongue having 500 grams of force, and it only takes 1.8 grams to move a front tooth, you can see if we get the tongue doing what it's supposed to, it's going to be on the top of the palate. It's going to push those front teeth out, and the whole jaw is going to develop around, and then there'll be room for the lower teeth.
Sure.
And the lower teeth kind of go along for the ride because the heels of the upper teeth fit into the valleys of the lower teeth. Sure.
Does the approach that you take, I know we've been talking about the crookedness of teeth. Mm-hmm. Does it also address, a lot of people are concerned about the spacing of the teeth, and second of all, the alignment of the jaw. Does it change that, or it just depends? If we get the airway working well, we'll see what happens.
It all comes together.
Oh, interesting.
The appliance I use is kind of like a soft night guard, but it has a place for the top teeth in the top and the bottom teeth on the bottom. So they grow together.
Okay. So it's like that little mouth guard will help guide the top and bottom appropriately.
So if you've got somebody with a great big discrepancy in the jaws, it will help pull that lower jaw up to the upper jaw.
Sure.
Forward to the upper jaw because it's got the spot for the upper teeth and the lower teeth in proper alignment. And the back of the upper jaw, lower jaw, the back of the upper will grow as needed as you pull it forward.
I see. Okay.
There's a lot of growth potential there.
Yeah, and I've heard the jaw is one of the last things to stop growing in the human body. I've heard what is it? Like in your 20s or something, your jaw hasn't finished growing, or I don't know, probably some crazy stat up there.
Well, there's cartilage up there.
Okay.
And cartilage is one of the tissues that has ability to grow.
Okay.
That's why old people have big noses and ears keep growing.
Yeah.
Of the cartilage
interesting.
In it. Yeah.
Interesting. They should talk about how wise someone is by how big their nose is. That's funny. Okay, so when we're thinking about we've been talking about how kids are more malleable than adults, but adults can still benefit. What is the ideal time for someone to come see an airway specialist like yourself?
Okay, Julie, I must correct you here. I am not an airway specialist because in dentistry there are certain specialties.
Okay.
So I'm a dentist who focuses on it.
Okay.
Or that's the best way to put it. Focuses on it or has special training in it.
Sure.
But a specialist would be like an oral surgeon or an endodontist.
Okay.
Especially the type of thing.
I see.
Oh, TMJ. Let's dive into that.
Yeah.
Any age start. If you see a baby with their mouth open, hey, this is something that can lead to problems in the future.
Yeah.
And there's no age that's too old to start thinking about it.
Okay.
But this also helps with TMJ oftentimes.
Oh, okay.
I've got a case that I started about a year ago. Actually, someone who works for me, her teeth were a little bit crooked. And I said, we've got to do this for you. And she had been suffering from TMJ pain for ages, 20 or years.
TMJ pain is not fun.
Not, but she'd wake up and her whole head and neck had pain. And she started to wear the appliance, and immediately that went away because there's tensions, there's imbalances. The teeth were a little bit canted. And so the one muscle here is pulling different than the other muscle. The muscles aren't in harmony. And by being able to wear the appliance, it was a soft appliance, and it put things in the right position. And now she's a little bit more than a year into treatment, and her teeth are looking fine, and her TMJ problems are gone.
Wow.
But why are their TMJ problems? Because they're imbalances. Muscles aren't being used the way they're supposed to. Something's tense here, and that goes all the way down the spine.
Sure. Yeah.
So we take pictures with crooked teeth, and their feet aren't right in alignment.
Sure.
Or a patient that came in, and it was adult. We were looking at his full body picture, and you could see that his torso was twisted compared to the bottom half of him. No wonder he had pain.
Sure. Yeah, that's so interesting because every time you hear about TMJ issues, a lot of the treatments like, oh, maybe some muscle relaxer or just turn off the muscles. And for me and Charlie, because we specialize in the muscle system, we find a lot of value in muscles working properly, not just turn them off. Right. And so we're like, well, there's got to be some other way, so it's interesting that you brought that up because in our philosophy, we're always like, well, muscles, if they're working properly, they won't feel like they're excessively tight or feeling uncomfortable putting extra stress on the joints, in this case, the TMJ. Right. But a solution that I don't feel has ever really held for a long time is just turning off the muscles because the muscles have to do their job. I mean, they're trying to do their job in the jaw. There's just something that's off, whether that's, the teeth alignment or like causing it to be askew or whatever. So it's very interesting. And I'm sure when you work on the airway, because it's so jaw related, that TMJ gets changed quite a bit.
TMJ and sleep are quite closely related, and oftentimes people think that is one or the other, and it's oftentimes the other or a combination of the two.
Sure.
Because a lot of the TMJ problems are due to grinding. Why is the grinding? Because the airway is not proper.
Yeah, I see.
And so the jaw is trying to find that open airway position.
I see.
And Julie, when people are grinding their teeth at night, the force is many times what it is during the day. So you can imagine the harm that's being done.
Okay.
So if you've got somebody with TMJ problems because they're grinding their teeth, they're grinding their teeth because the airway is not adequate. And because the airway is not adequate, they're not getting their sleep, which makes them grumpier and less able to tolerate pain and less able to handle their day.
Yeah.
So you can't.
Well, anytime sleep is compromised.
Yeah. So you can't separate anything because it's all so interrelated.
Sure, I see. So is another way to tell if the airway is obstructed, especially I guess in older individuals, is if you can tell they're a teeth grinder. I'm sure.
Teeth grinder, yes. Teeth grinders, especially if they have a lot of wear in their front teeth.
I see.
Pathognomonic for sleep problems.
I see.
Grinding of the teeth if they have a high, narrow palate. Mouth breathing, open lip posture. All this stuff is the same problem.
Yeah.
Just different aspects of it.
What is the normal treatment length if someone's working with changing, their muscles and their habits and their facial structure? Or is it
in general, it's 18 to 24 months.
Okay. Which is normal for braces, too. I mean, it's not like it's any slower. Yeah.
You see a lot of movement the first 6 months, and people are all excited. When you get to about 18 months, people are getting tired. They don't want to be wearing the appliance anymore. The appliance I use most is worn an hour to 2 hours a day, and then it's worn overnight. At first, that comes out at night because the body's not used to it, and it has to be trained during the day when you're conscious to work at night.
I see.
So that's why it's an hour or two during the day, which is a challenge for some people because they're running around and they have to be quiet. It doesn't have to be an hour straight. It could be 3 20-minute sessions.
Yeah, because the appliance, it's like the top and bottom are connected.
Right.
What would be great? It would be great for someone that's trying to diet too, because they have to keep their mouth closed.
Well, yeah, it's interesting you bring up diet, Julie, because it is an airway issue. I mean, I can almost always go back to everything being an airway issue.
Yeah.
If you don't get your sleep, and they've done lots and lots of studies in the last 10 years, if you don't get your sleep, you are given a double whammy by the body. There are 2 chemicals that the body has that help regulate your appetite. They both start with G, and I can't think of the names right.
One's ghrelin.
And there's one that says eat more, and the other one says eat less.
Yes.
When people are sleep deprived, and this has been studied, researched, and found, when you sleep less than you should, you sleep deprived, 5 hours or less, the one that says eat more is stimulated. The one that says you're satisfied is suppressed.
Yes.
So it is important for you to get your sleep if you want to stop eating.
Oh, definitely. I mean, I think we can all relate to that. It's like when we're sleep deprived, we eat more.
And more carbs, the more unhealthy foods. They've done studies on that too.
Yes. So what would be the youngest individual that you could work with if they're going to wear an appliance? Could they have baby teeth, I guess?
Oh, yeah.
Okay.
Yeah. We've got the little appliance it's just like a chew little thingy. It's only on one side. It's not a full appliance. It goes in there. There's a handle on there. We want them to exercise their jaws.
Yeah,
I
see.
And that's what we do. We start with a simple appliance, and then as they get older, yes, we start with baby teeth. Why? If you go to the doctor's office and the doctor says, well, you're not diabetic, but you will be in the future, would you say, well, let me wait till I'm diabetic, then treat me? Wouldn't you want to have something done right away?
Right.
Well, if the baby teeth are not getting spaces by the age of 4 or 5, that means there's not going to be enough room for the adult teeth.
I see.
We can get working on an appliance at that time.
So that's why baby teeth they've got spaces in between them. Like they're supposed to.
They're supposed to at age 4 or 5. When they first come in, 2, 3, their teeth are together, that's not a problem.
Sure.
But they need to be opening up.
Sure.
And maybe some palatal expansion may be needed in addition to this appliance here to help create the space for the tongue to go so that they can develop into a healthy young adult.
Sure. That's fascinating. I think it's so cool how you can start seeing some of these signs even before it's happening. And I'm sure being in your shoes, it's difficult because so many people are unaware of this, including, Charlie and I. We never heard of this until you said, hey, I've got something I want to talk about. And I was like, wow, that's fascinating. And that you see the early signs, and it's not something that many people see as early signs. Do you know what I'm saying?
Right,
it's like, it's just along all those preventative measures. It's like, how do we know what we're preventing because we don't know what's happening yet, So that's really cool that you're already looking at this and that this is a new field, because I think there's so many mouth breathers out there and so many people struggling with sleep apnea and so many people not getting the sleep they need. And it's so important that, people are getting the sleep they need. And I mean, just from feeling lively throughout the day to the serious health conditions that it can lead to. So,
exactly.
Yeah, I appreciate you sharing all that with us.
Do you talk with your patients about stress management at all, from hey, when you get really stressed and your breathing becomes more shallow, and anything like that, as far as the effects you see on people's stress and how it plays with their breathing?
I guess we can add that to the schedule now that you mentioned it.
No, I was just curious if you noticed, because I'm thinking, especially like with adults, one thing that I don't know if it's a contributing factor or not to why somebody might be breathing in a specific manner is, hey, if they're really stressed throughout their day, that may be kind of affecting the habit of breathing that they're in.
I'd go back to airway and sleep, and you become more stressed when you sleep less.
Yeah, I'm sure they feed into each other,
and you can't separate anything. I know the medical society community does separate. You've got your ENT, you've got your toe doctor, you've got your heart doctor, blah blah blah. But breath does trump everything, and TMJ pain is oftentimes the breath in sleep is not right, and that's because the breath in waking is not right. So it just gets more and more complicated. And sometimes people don't think they're not sleeping properly. And if they're breathing through their mouth all the time during the day, then they're not getting the oxygen that they're supposed to. Mm-hmm. And that's going to be stressing it. So,
sure.
You know, where do you start? It's a very good question.
Yeah.
But closing your lips, trying to breathe through your nose is step number one.
Yeah. You know, you were so kind and attended our health summit. A lot of our listeners have heard about the health summit, and so many of our speakers, they had diagrams to explain their concept where it was a circle. You know, this leads to this, leads to this, and it seems like, you know, what you're talking about could easily be a circle, you know, where it's like this could lead to this. And it's like, where do we intervene? And you're definitely creating a great argument for how we could intervene with the oral health and the breathing health and the mouth and throat and things like that. That's very cool.
And a lot of them were very enthused about proper diet, and that feeds into me too, because if you're not eating the proper foods, your jaw is not going to develop. If you're not eating proper foods, you're going to have more inflammation. It's going to be harder to breathe through your nose. As you say, there's no separating anything. Everything's related.
Sure.
Everything's related.
Sure.
So getting back to your question, most often I'll start on a 7-year-old. Why? Because at 4 or 5, I'll say there's no spacing between the baby teeth. Your jaw's not going to grow. The kid's jaw is not going to grow to the full potential. There's going to be a problem with the adult teeth. Well, they don't see it. And I get it. You don't see the problem. You're not going to act on it. Well, at age 7, the adult teeth start coming in on the top. The bottom teeth come in at 5 or 6, the first 2 on the bottom. So then they see the problem. Oh, yeah, let's get started. And that's a very great age to get started. We still have got some time before the teenage years hit. Once we get the teenage years, we can still, of course, treat. But the teenage behavior and compliance tends to be a bit more of a challenge.
Yes.
Whereas at the younger years, they're usually still trying to please the parent.
Sure.
And as my coworker says, we want to get people to understand the earlier we start, the longer you'll have the benefits from this. The longer you'll be able to sleep better. The one child I started at age 3 when mom said, oh, the teeth are a little bit crooked. Well, his mouth breather and gave him the very simple little appliance. Came back in 3 months. First thing the mom said, I kid you not, was he's not catching colds anymore. This is health. I'm not just straightening teeth. And if you check, the teeth were straight too, but mom was just amazed at the health. Another parent who started the kid on the program goes a month or 2 after we started, oh, she's not grinding her teeth at night. Thank goodness we took care of that. Yeah. So this is overall health really making a change.
Yeah.
Sleep is so important, and it's not really recognized as much as it really should be in many fields.
I see. Interesting.
Well, in to that point, when it comes to sleep, people are like, "Oh, well, you know, I'm in bed for 8 hours." You know, that's how we're qualifying sleep health or quantifying sleep health is how much did you sleep, as opposed to the quality of the sleep, and you know, how's your body functioning while you're sleeping? Are you snoring? Are you having this? Periods where you're waking up throughout the night, whether you're realizing it or not. You know, how is your breathing while you're sleeping? And so, yeah, to your point, sleep is not looked at. It's not well understood from the kind of general consumer standpoint. And for the most part, it's all about, well, did you get your 8 hours or not? And that's about as far as people go.
Well, it's very difficult because you're unconscious, and the only way to really know how you're sleeping is to have a sleep study done.
Yeah.
And the other thing is the medical community, and I'm not trying to badmouth them. I'm trying to be serious and help explain the situation. They are not taught to respect sleep. The rounds that they have, where you're up, I don't know how many hours at one time seeing patients, you couldn't do it if you were a truck driver, but it was put into effect by the guy at Johns Hopkins who was in charge of the surgery unit, and he was a coke addict. And so they've not overcome that disregard for sleep. Okay, you've got to be on rounds for 12 hours or whatever it is, suck it up. Rather than understanding that sleep is really the elixir of health. If you're not sleeping right, you're not going to be healthy. There's no way you can be healthy. And we shortchange sleep, we've got our electronics or whatever it is. Oh, we can get by without. We drug ourselves with caffeine, whatever it is. And on top of that, you bring up a good point. People don't know how well they are sleeping because they only know the sleep they have. The adult that I made an oral appliance for, a sleep oral appliance rather than a growth oral appliance for, goes, man, I've got the energy now. Instead of asking someone to go get something, I'm walking and doing it. I got so much more energy. I knew I wasn't sleeping well before, but now, geez, this is really great. Mm-hmm. But you can't go to the store and say, okay, give me one night of good sleep and one night of bad sleep so I can see the difference.
Yeah.
And you ask people, how do they sleep? And you're right, they'll tell you how many hours. It's not whether they're getting the REM sleep, the non-REM sleep, the restorative sleep, the sleep that will help put your thoughts of the day together. So for the memory, a lot of people complain about poor memory. Well, it could just be you're getting poor sleep, and if you or it could be not enough sleep. I had a young woman working for me, and she said, yeah, she was like 24, and she goes, yeah, when I was in high school, I had a really good memory. I don't anymore. Well, how many hours are you sleeping? Well, if you're not getting your 7-8 hours of sleep, don't expect remembering things because you don't have the time to get down to the point where the brain can process what you've had during the day for it to go in the proper memory storage.
Interesting.
Yeah.
Yeah, it seems like the basic... It seems like you're trying to address the basic health of how the mouth and jaw should be functioning.
Correct.
And I really like that because we kind of take that philosophy with muscle activation techniques, which we do here, and our podcast listeners know all about that. It's like, hey, before we go and make assumptions that you have these awful things going on and these crazy diagnoses, let's just get the muscles working better and see where that takes you. Or in your case, let's just see if we can get the jaw to work better and the airways to function the way they're supposed to, and let's see what happens, because it's so tightly related with so many other things.
Right, absolutely.
So Dr. D, you've described a lot about kind of what happens in your office in terms of you helping patients improve their health. I'm curious if we can kind of sum it up in like 3 things our listeners could do to help improve their breathing and whatnot. Kind of what I'm getting, and tell me if I'm correct, is 1, focus on breathing through your nose. And this is done by breathing deeply into your belly, making sure that your lips are together when you're breathing and that the tongue is, pressed to the palate. I'm guessing gently pressed to the palate and kind of along the back side of the top teeth. Is there anything else you would recommend helping people doing as far as improving their breathing, improving their airways, and helping to make sure that people are breathing properly?
Well, you put it in a nutshell.
Okay.
Good, we were listening well.
Tongue on the spot, close your lips. That also helps with posture. And that's going to help with the rest of the body. It's all connected. The head bone's connected to the toe bone. It really is. And it was interesting when I was explaining to kids. Well, do you want to be like Cinderella and you put on the pursed lips and the I'm the sweet girl look, or do you want to look like a codfish when you grow up and you open the mouth and start breathing like a codfish? Well, you have to be kind of hilarious with these kids because if they're going to be wearing an appliance for an hour a day, we have to work with them. And what I thought was so amazing was when I made the codfish, my shoulders came forward, my posture really worsened. And it's like, gee, really, everything is all connected. I didn't realize. I just tried to open my mouth to show what a codfish would look like, and my back is changing shape. So it really does all connect.
So, Dr. D, we're curious, what do you do for your own health and well-being throughout the week? Because we talked about a lot about what our listeners can do and what your patients do, what you do for your patients. What do you do for your own health and well-being throughout the week?
Well, I do work out. I do some yoga, so that's the meditation and mindfulness with that. I do some kickboxing. The other day I did some swimming. Just try to mix it up a little bit.
Great.
Walk my kid to school whenever there's a chance. I try to eat right and smile.
That's
great.
Think positive.
Love that. Love that. So where can our listeners connect with you? Let's say they're listening and they're like, you know what? I'm seeing in my kid, I'm seeing in my own self that something's not going right with my breathing. We're breathing a lot through our mouths. Where can people connect with you to find out more about what you do and possibly schedule an appointment with you?
I'm at Serenity Dental here in Schaumburg, Serenity. I know that's a weird word to spell, Serenity Dental. And anybody can call the office, schedule a complimentary half-hour consultation. If you think you're crazy, that's fine. But a half-hour complimentary consultation, and we'll see if there's something of interest that we might be able to do for you.
Fantastic. We will put all those details in the show notes below so our listeners can check that out.
And I know a lot of our listeners got to listen to our podcast last year with Dr. Heider.
Oh, cool.
And Dr. D is actually her neighbor. So
Yes.
if you know where Dr. Heider is, you know right where Dr. D is as well.
Right on the corner of Schaumburg and Roselle Roads.
Yes.
Perfect. So, Dr. D, the question that we always like wrapping up with all of our guests is, what is your definition of health?
Oh, wow. Physically and mentally, body we're working at its optimum.
Love that.
Did I do a good job?
Well, yeah, no, I mean, that's great because, like we say, with all of our guests, everybody's approaching it with looking through a different lens, looking through a different viewpoint based on your personal experience, based on your professional experiences,
right.
And to have your body working as optimally as it could. I mean, really, what's better than that, right? And mentally, physically, I mean, that's awesome. So, yeah, I think you nailed it.
Yeah. Hey, well, thank you so much for your time and your insight into this really fascinating topic. I always think oral health is really interesting myself. So I appreciate you sharing all your information and your experiences and your knowledge with us today and to our listeners.
Thank you so much for having me. It's been a pleasure. It's been real fun.
Oh, thank you.
Thanks for the opportunity.
Absolutely. Well, for our listeners, who do you know that needs to hear this podcast? Who do you know that needs to connect with Dr. D and learn more about what she's doing and see if you need to improve how you're breathing? Share this episode with them so they can learn more about the awesome work that Dr. D is doing. And while you're online, if you wouldn't mind, head on over to iTunes and leave us a rating and review so other people can find us. It helps people who are looking for health podcasts, who are looking for dental information, who are looking for exercise information, find our work. So if you found value in this podcast today, take a couple seconds, leave us a rating and review, and it does mean the world to us. Well, thanks so much for tuning in. We always appreciate it. Have a fantastic week, and we'll talk with you all next week.